our Mind Your Poo seminar on what to do with all of the poo that horses produce, creative ways to manage it, manage flies that come with it, all that kind of stuff. So we have that coming up July 25th. We have a summertime blues seminar. So all the things that we have fun with in summer, skin funk, more bugs, you know, just the joys of summer, non-sweaters. We're going to talk about all that in our summertime blues. June 22nd, that's right. June 22nd is the Piggy Ice Cream Social. If you're looking for a good time on a Saturday, I highly recommend the Piggy Ice Cream Social. We have pigs and watermelon, which is really entertaining. And then we have ice cream for the adults. So Piggy Ice Cream Social, June 22nd. It's from 10 to noon. It's the most fun you've ever had with a pig, I promise. So, moving on to the very famous human sitting behind me. So, Dr. Brooks is probably the most amazing equine eye guy that you've ever been around. He's certainly the most amazing one I've ever been around. And I think he's the best one in the world, but he probably won't acknowledge that himself. So without further ado, I'm going to turn it over to Dr. Brooks because he knows more about equine eyes than anyone in the universe. So there you go. Dr. Brooks.
Thank you. This is my own horse, and isn't she the prettiest horse you've ever seen? And her daddy won $3.2 million. He was pretty famous thoroughbred, and so I think the breeders thought they had high hopes for her. She raced once, and jockey fell off the horse in front of her, and well, she won $125, and was a failure as a broodmare, and yet she's just beautiful, and she's really a nice horse. Anyway, I worked at the University of Florida for 34 years and retired. Well, I didn't retire, I quit. But I mean, I told them I retired, and I'm really proud of what we did there. But now I'm doing different stuff, and it seems like now I'm working with blind foals. And boy, will that tear your heart out. And but we're going to talk about that a little bit. And I like to think like I'm a nice guy, but you don't really want to get to know me. If you recognize my voice on the telephone, you got a horse with a bad eye. And I don't get the easy stuff anymore, and that's okay, but it's what I specialized in. My whole career was doing stuff that nobody else wanted to do. So we're going to talk about ways to avoid me. This whole and have Springhill take care of you. Anyway, we're going to talk a little bit about eye exam, and we're going to talk about corneal ulcers, and then we're going to talk about what you see on your farm or at your house in the barn, what a horse looks like when an eye problem is just beginning. The horse eye has tremendous healing ability, but the diseases that attack it are very powerful. And the sooner Springhill gets involved, I get involved, the sooner we get started early in the disease process, the more likely we are to have a positive outcome. So we're going to talk about colors in a minute. You see, this horse eye's got some blue, and it's got some white, and it's got a little bit of red. So we're going to start. I want you to start learning about what the colors mean, because then it helps you understand whether the treatment's working or not working, or what to expect. It's my nice. Horses have two eyelids, basically. We're mostly concerned about the upper lid. We'll get this at the end of the lecture. The upper eyelid's the one that moves. Except in some quarter horses, the lower eyelid doesn't move much. So when we see eye diseases that involve the upper lid, I'm much more nervous. Because if the disease doesn't get better, then we may have trouble with blinking, but we'll come back to that. Here's just a pretty picture of a horse with a blue eye. You see how shiny it is? The flash in the camera is very shiny, and that's because there's a layer of tears. Horses have a tremendously thick tear film. Most veterinarians don't know anything about the tear film in the horse. It was never emphasized in school much, but that's all changing now. But the eye should be shiny. If the eye looks dull, there's something wrong. And where we live here in the state of Florida, North Florida, you have to consider fungus for every eye disease of the horse almost. Every horse eye disease, you worry about fungi. And fungi can make the eye, the surface of the eye look dull and dry. In real bright light, horses, the pupil gets really small, and horses will actually have two pupils. Then they have all these cystic structures in the middle. And nobody knows why that is. I mean, it's like this eye, the pupil's nice and dilated. So, I mean, you and I have one pupil. Horses, at least in dark light, have one pupil. But you put them in light, and now they have two. And that's an amazing kind of thing to think about. It's like, why? Why do horses need two pupils? This is a picture of a cadaver. I just want to go through some terminology so we all kind of understand the names that go with this. It's a nightmare. I apologize for that, but there's a couple names we need to learn. We need to learn what the cornea is. The cornea is the outer clear part of the eye. You got to know cornea because corneal disease is very common. Corneal disease is common in the horse, and most of corneal problems we can cure. But corneal healing can be very slow, and that kind of frustrates everybody. The iris is the colored part of the eye. It's brown, and this one, the last horse was blue, had a blue iris. The lens is for seeing up, helps the horse see up close. And then the back of the eye is the retina. Mostly what I work on is cornea and lens. Okay, most of the eye diseases that your own horses might have will involve the cornea, or maybe the iris, but it's the front of the eye. So we kind of divide the eye into a front half and a back half, and you'll hear me talk that way. The front half is doing this, the back half of the eye, and then what happens is the retina, all the little nerves in the retina form the optic nerve. The eyeball doesn't see anything. The eye doesn't see anything. The eye's a photoreceptor. The brain is what sees. And I want to share something with you. A week ago, in Ocala, a 6-month-old horse, beautiful horse. They were training him to get in the trailer. He reared up and hit the back of his head on the trailer and lost his sight. Boom, it was gone. God forbid this ever happens to you or one of your horses, but if you ever see that happen, you need to get a hold of Springhill, and they'll get a hold of me or something. That horse got put to sleep because they didn't treat it correctly. There didn't used to be a treatment for this. What it is that the injury was to the brain. So the horse rears up, hits the brain, basically through the skull, causes hemorrhage, bleeding inside the brain, and the bleeding's what blinded that horse, and there was no treatment. There is a treatment now, but the people didn't know. So, my point is, things are changing. We're improving our ability to treat some of these eye diseases in horses. So if you don't wait, if something's going on, get a hold of Springhill, and they'll get a hold of me or whoever, and we'll have a discussion about whatever the problem might be. What does a horse see? And I mean, in order to work on them, and many of you know this anyway, if you're riding them, you have an idea, and probably a pretty good idea. Horses have tremendous peripheral vision. They have some stereo binocular vision straight on, and they make nice diagrams about all this. I always think this is funny. But you and I don't have much peripheral vision, but a horse can see all the way back to its tail without moving its eyes or moving its head. But when does it do this? When a horse is grazing, that's when it has this peripheral vision. When its head is down, the eyes flip up, and the pupils are horizontal, and that's when it can see, without even trying. But if the horse has got its head up, and its ears up, and staring at you, it's not seeing its tail. It's looking at you.
and then it's binocular vision. And it's kind of a unique thing to the horse to know that. And so what does it look like? You and I see that this house like this, and if we're standing and staring, the horse would see this. It's tremendous peripheral vision. Horses see color, but not maybe the color like you and I see. It's a picture of me and all, yellow, red, and blue. Horses don't see red very well. So to me, a horse looks, this is what I look like to a horse, I guess. And how do we know this? Because of the anatomy. Horses don't have red cells, but they have yellows and greens and blues. And why is that? Because their eyes are adapted for seeing in the dark. And blue light's more important to see and detect. Red light doesn't go very far in the dark, so blue light is much more important for them to see. Sort of like this, you and I see the color here. A horse sees the same as this. You lose the reds. In the dark, you and I see this, and the horse sees this. Horses' eyes are adapted for seeing in the dark, except for which breed. Which 25% of the horses of what breed of horse don't see in the dark very well? Appaloosas. 25. Most of the owners don't even know. But they're not out riding their horses in the dark. They don't know. But it's a congenital night blindness kind of thing. Anyway, what do you think of this video? This is I think he was 12 years old, Dutch, warm blood. When I show this to veterinarians, they say, well, no, he's a good mover. I'll let you watch it for a minute. I love this movie. It's one of my greatest failures. What does that mean? If you're up a little bit closer, some of you could see the white of his eye. Well, his whole cornea is white. This is my favorite part, sorry. I like this one. So I had horsemen watching this. I want them to tell me what's wrong. Here comes the wave. Imagine that. So what's wrong? What's wrong? Well, he's blind. And then that's going to do horse that. He's blind in one eye, they'll say. Oh no, this one's blind in both eyes. The farrier came, and people lived in down South Florida, and the farrier came, the horse stepped on a nail, got infections. He was systemically ill, had a fever, had abscesses running up both jugular veins. The inflammation went into both eyes. He got glaucoma, which means the pressure's too high in both eyes. I got called in at that point, drove it like a madman to South Florida. Looked at this horse. It was a beautiful, beautiful, beautiful horse. The inflammation was, you could just feel the heat coming out of his eyes. I got so upset. We looked at him, got therapy, some therapy started. I was so upset I left this property and left all my equipment. Had to sneak back into this high security area to get my equipment. And it destroyed both of his eyes. Destroyed them. And it's called uveitis. We'll get back to this term in a minute. Uveitis means inflammation of the inside of the eye of horses. It's the most common cause of blindness in adult horses. And so people said to the owner named Jeanette, what are you going to do with him? He's blind. What are you going to do with him? And no people, Jeanette said even I said it, but that doesn't sound like something I would say, but I guess she would. What are you going to do with him? Well, he's not lame. I might as well train him. So she did. He's amazing. He 9 years old when he was hurt, lived to be 28. And I used to go to demonstrations and stuff to show. I know, it's part of my job to say it's not safe to ride a blind horse. It's probably not safe to ride horses anyway, but it's like, somebody asked me, do you ride? I said, yeah, I ride bicycles. I said, you don't ride horses? Wait, what? My response, what a dumb idea. But I liked him a lot. It's like, I'm not right. Anyway, how do we test vision? Are there simple ways to test vision? And it's important, especially in really bad corneal disease. When you, as the owner, need to know, what's the chance if I treat this eye that it's going to get better? You know, if I do the therapy, spend the money, what's the chance it's going to see when we're all done with this? And so one of the things that people do is they wave their hands in front of them. The horse eyes are adapted for detecting motion. So if you move your hand in front of them, you see, here I'll do it again, because I edited this movie, and okay, there she responds. Now she's still blinking. It's like, okay, now she didn't. It's like, okay, this hand motion maybe isn't the best way to evaluate vision in the horse. There's another test called the dazzle, where you just take a bright penlight. This is my other horse, and you shine a light and see if the retina is not working, the horse won't respond to a bright light. Right? So that light's a little pen light, but it's really bright. I got one with me if you want to see it. It's really bright. And if the cornea is sick, light will go through it. If there's blood inside the front of the eye, light will go through it. If there's a cataract, light will go through it. And then they'll squint. And that's a good sign. If they don't squint, that's not so good. If they don't respond to hand motion, I don't really care. But if they don't respond to light, that's a problem. And then that influences what kind of therapy I would recommend. Now, I'm not very smart, despite what Erica said. I mean, I'm just a dumb vet from Western Illinois. You know, I don't know nothing except the river, the Mississippi, right? Okay? But so I made this simple. Horses get 2 eye diseases. Right? Here's one of them. They get corneal ulcers, which we'll define in a minute, and they get this thing called uveitis. If your horse has an eye problem, and you call a vet in, what you want to know is, does my horse have an ulcer, or does my horse have uveitis? Ulcer, uveitis. Ulcer, uveitis. Because the therapy is different for these. And both of them are treatable diseases. But you got to know which one you're dealing with, because the therapy for uveitis is different than the therapy for corneal ulcers. Okay? But what's the third thing? This is everything else. Okay? There are other things, and we'll talk about some of them, because there's now new diseases in Florida, new eye diseases of the horse. Oh, great, right? We had no problem with the old diseases. Now we got new ones. And they really, pardon me, they suck. Okay? But we'll get to that in a minute. How do you tell if a horse is feeling eye pain? I want you to start watching the eyelashes on the upper lid. Okay? Most horses, the eyelashes point straight out. When a horse is getting a little bit painful, if the eye hurts them, the eyelashes on the upper lid will start to point down. When I'm working on if I was working on your horse, you and I would have the discussion about watching at home the position of the lashes. When I say if the eyelashes are pointed down and we institute therapy and the eyelashes come up, that's a good sign. That's what we're looking for. That's a positive response. But if the eyelashes go down, the horse is uncomfortable. That's the most sensitive thing that I know of to tell if a horse is having a problem with its eye. It indicates pain. Now, there's some ponies go through life just like looking through their lashes, and that's normal for them. So, but for the vast majority of horses, the eyelashes are perpendicular on the upper lid. So now let's talk about colors. Normally the cornea is clear. If the cornea turns blue, that means one thing. If the cornea gets red, that's usually good. But if the cornea is whitish yellow, this is not good. Blue, well, whitish yellow is white blood cells. And they are definitely evil. The horse cornea doesn't like them. They're really bad. There's not much we as veterinarians can do about them. Blue is water. Blue is water. It'll go away. I don't care most of the time. If it's blue, it'll go away. Normally the cornea does not have much water in it. When the cornea gets sick, it turns blue. I don't care much, okay? Whitish yellow, I care. I care a lot. Red is blood vessels. And look how red they are. They're not just one or two of them here. There are a whole lot of them, and they're flaming red. And they're trying to heal. In this eye, they're trying to heal this group of neutrophils, this group of white blood cells. They're growing to here. So, at least in this case, this eye was not going to heal until the blood vessels grew into it. Now think about that a second. It doesn't seem like it's obvious to most people. If the horse has a corneal disease, and it won't heal until blood vessels grow into the lesion, into the bad area, what's in blood why do we have to wait? Why don't we just start using the blood as an eye medicine now? It's actually a really old therapy, but only has it become common to veterinarians recommending using blood as eye medicine in horses. Cattle ranchers know it. If a cow has a bad corneal disease, they can just nick the eyelid a little bit and blood will drain into the eye because the ranchers know, at least some of them know, that the blood has healing powers. So you may find, don't be surprised, if your horse has an eye problem, that the veterinarian wants to put blood as an eye drop. Well, number one, can't beat the price of all those things that medicine and horses are big. They got lots of blood. So it's really a free therapy. It can make a world of difference using the horse's blood as eye medicine. Now, here, look at this. We went blue, whitish, yellow, and red. Okay, one more thing. Dark. Dark. Dark means thin. Dark is bad. Not horrible, but dark is bad. If we have a corneal ulcer or some of the cornea is missing, the horse cornea is about 1 millimeter thick. It's incredibly strong, but it's really thin. And if it gets thinner, and you shine the light, it starts to look dark. So dark is thin, dark is bad. And if you see this one, this guy's got a dark area that's going around the whitish area here. This area is starting to get thinner. This is called the gutter. And it's a really difficult situation for this eye. Because the horse is, when horse corneal cells get injured, what does the horse do? It gets rid of it. It sloughs them off. And how does it do that? It does this by forming these gutters. And we all struggle. When I see this, the horse, we get really afraid. Here's an example. Here, look, blue is water. Do we care? Red, blood vessels. Whitish is cells, white blood cells. But look how far away this distance is. It takes a while. If this eye has to turn red to get better, it takes a long time for that to happen. And look at the top, dark. This is dark. Dark means thin. And when your vet sees this, they're going to call me because they're going to be afraid. If I were to see it, I'm going to be afraid because it's thin. And so I did medical therapy on this. Look what happened. Dark is bad, right? Dark is bad. And what happened is this area ruptured, and the iris, which is brown, came up to plug the hole. This eye is trying to save itself. This is what the horse does. It took me years to figure this out. It seems like it's really simple, and it is. But sometimes the simple things are the hardest things to figure out. When the eye ruptures, the horse tries to save itself. And what I try to do at that point is not get in the way. This eye is trying to heal, and it does, eventually does. So now, you call in a vet, what do you expect them to do? Well, if the eye is painful, you expect the vets to do what's called a fluorescein test. Now look, this guy's swimming. Look, the eyelashes are pointed down. I mean, it's pretty obvious. There's a dye called fluorescein. All vets carry it. If you have horses with eye problems yourself, or have had horses with eye problems, I think you should have fluorescein on hand on your farm. To you, it's simple. What you do is you wet it, you touch it to the eye, and if there is a layer of cells missing, it'll stain. This is called an ulcer. Ulcers can be superficial, or they can be really deep. The whole horse cornea is only a millimeter thick, so that's not a lot of tissue. If I see a corneal ulcer, they're going to get some sort of antibiotic 4 times a day to start. We'll put them on atropine to dilate the pupil and help with eye pain. They're going to get blood or serum 4 times a day, and we're going to give them some bandage. This is how we start. Okay? Now, what we know is this. A 5 millimeter diameter ulcer should take about 5 days to heal. A 4 millimeter ulcer, 4 days to heal. It's about 1 millimeter a day. So we have an idea as to what should happen with this. So if you get involved now, and it can be faster or slower, and I was talking to some of the Springhill people before you all got here, and they were talking about having superficial ulcers that did not obey that rule. It took them 2 weeks. I said, okay, it's probably infected, different kind of infection. But I mean, it's like, in general, a 5 millimeter diameter ulcer takes 5 days to heal. And that's important for us, you and me, trying to figure out how long to treat them. Or look what I just recommended you do. 4 times of this, twice of this, that's 6 for 10 times. 10 times a day for 5 days? That's, you got to treat your horse 50 times. This gets to be a lot of work. Classically, I see this, and it's funny, but it's not really funny. It's like, I see a horse, I say, we need to do this, this, and this, and then I see them a week later, and the owners come back, and their eyes are really dark, and they haven't slept, and they look really tired, and I go, and they go, well, we'll pay you to do it now. I go, okay. And it's like, this gets to be work. However, most ulcers will get better. It does take a lot of work. But because the horse eye heals, it just doesn't heal quick. And so I try to do things and recommend things that help the horse heal. There are surely things we can do to slow it down, but why would we do that? We want to do things that speed up healing. We can put in tubing systems to make it a little bit easier. It's otherwise, my own, I showed you Shooter a picture one with the nasal reflex. He was the worst horse I've ever seen. He had a 5 millimeter diameter ulcer that was really deep, and he was going to be terrible, and I was so mad. It doesn't do any good to get mad. He didn't care. It didn't bother him one bit. I mean, if I would have hit him, I would have broke my hand, so it's like, he didn't care. He's impossible. Anyway, I was lucky that he got better real quick. But I was thinking, I'm taking him somewhere, I'm paying somebody else to do this because I'm not going to lose my mind over this anymore. So you put these tubing systems in. They're not perfect, but they do help. And what happens is the tubing runs back to their shoulder, and you inject the medicine back there, and it goes through the tube and comes out of her eye. I had one of my clients who was treating her horse. She was treating it 400 times a week. 400. I was afraid to calculate it out, but she did. Because it's like, she was doing it. But it worked. Ulcers. Ulcers are the corneal disease. It's very common. It's what you stain with the fluorescein dye. And what an ulcer is, there's some of the cornea missing. There's tissue missing. They get thin. It's easiest to see with the fluorescein dye. Okay? I mean, you don't need it. I mean, you can see, I can sort of pretend that I see the edges of the ulcer there, but it's just easier with that forcing. So it's really good. Every horse with a painful eye gets stained. Okay? You call a vet in, your horse is painful. That vet should walk away with orange fingers because the stuff gets far. You know, actually, if you get it on a white shirt, it's water soluble. It'll come out. Don't worry. But it's, that's what you expect. You got to know. So let's look at this. I learned a tremendous lesson on this. Look, it's got some blood vessels. It's blue. It's got some whitish area in cells. This was actually a fungus. So look what happens. I got medical therapy started. This is a different stain called rose bangle, but it was rose bangle pie. It means there's tissue missing. The tears are missing. So I got medical therapy started. A few weeks later, it looks like this. Well, he's feeling better. The blood vessels are growing in, and he's got a big abscess here, a big bunch of white blood cells. Keep up the medical therapy. 5 weeks. Looks like he's done. Well, it looks terrible to me. But he's not painful. 5 weeks. He's off medicine. So, well, we walk away. And I was driving by this horse in Ocala, and I was driving by 5 years later, and I went in and looked at him, and my goodness gracious, I wish I'd gone back in 6 months now and seen what he looked like, but at some point, he looks fantastic. He went from looking terrible on his own. This is called remodeling. This is what the horse does. The horse doesn't heal fast, but it can heal. It just takes its time. I don't know why the horse does this, but it does. There are times when we veterinarians, we need a little help with these ulcers, and we'll say, we'd like to do a little scraping. And scrape the cornea, look at it, the scraping under the microscope. Make sure we're using the right medicine instead of guessing. And I do this all the time. It's cheap, and it can provide extremely useful information. And people do it with different things. If you're squeamish, you probably don't want to watch. We sedate the horse. We do a nerve block so they can't blink. We put topical anesthetic on here so they don't feel anything. And we just scrape away some of the cells and look under the microscope. You can use little brushes and do the same thing. This is one of them. You see the dark area? Dark is thin, right? So I tell vets, don't scrape the deep part. Just scrape the edges. So this is what we're looking for. If the initial therapy isn't working, the vet's going to say, I need to scrape it. I need to see what kind of cells are there. This horse changed my life. Because it's not just part of the cornea, like here, it's a small area. In this horse, it's the whole cornea. I didn't know what to do. I didn't know what to do. Because the whole cornea is bad. This is called melting. It's a word you don't want to hear. If your veterinarian says the ulcer's melting, that's really bad. Melting means the cornea, which is only a millimeter thick, and if you don't know the metric system, it's like that's an eighth of an inch. It's really thin, but it's really strong. But what happens is enzymes get in the tears in some ulcers, and they start to liquefy or melt the cornea. It can happen very quickly. I mean, overnight, hours. The worst one I ever heard was an Ocala horse, and it was a horse vet's own horse. It was a baby. Oh, he got weaned, that's right. He got weaned, didn't like it. Wanted to stay with the vet. So he panics, runs around, falls down, hits his eye on the fence or something. She checks the eye, it was fine. 5 hours later, it looks like this. It's like, this is really one of the best vets I know, and this happens to her own horse. So she said she wouldn't have believed it if she hadn't seen it herself. So melting is bad. Now, me as a veterinary ophthalmologist, I anticipate this. And so this is one of the things we use blood for, just to slow down the melting. And what I did with this, I ended up going to surgery on this. I'll mention a little bit later what we did, but it's like I didn't know what surgery to do. The books were incomplete. And there's various ways. The problem is, with surgery with this melting, the problem is we use absorbable sutures, and the melting will melt the suture. So how do you suture? I'll show you in a minute. But this one changed my life, my career. Here's the blood. If you have a ulcer, the melting ulcer, your vet's going to give you a bunch of tubes of blood and put it in a bottle for you, put it in a syringe, and you gently spray it up on the eye. Here's a melting ulcer. Now, if you're not sure what melting is, just remember the term. Remember the term melting, and assume that if your horse has a corneal ulcer, it is melting. Because it might be tomorrow anyway, so just assume that they really need the drugs fast, and that melting is part of the scenario. Various things, sometimes these end up being surgery cases. This guy has, what I did on this one was rotate some of the pink part of his eye, it's called conjunctiva, and we rotated it out here and sutured it to the cornea, and it formed a scar. It was a little scar, it look better later to see. So we went from here, and it looks a lot better. It's all medicine at this point and so forth. But sometimes melting ulcers need surgery. And it's not, I prefer not to do surgery, but sometimes that's the only thing that makes any sense. So we'll come back to ulcers in a minute. In 1996, I went to Sweden to look at horses, and the Swedish vets were showing me all these horses of this eye disease I've never seen, and they didn't know what it was either. Guess what? That eye disease is in Florida now. I don't think I brought it with me. I sure didn't need to if I did. It was a long time ago, but things change. And there seem to be 4 or 5, depends on how you talk to it, 4 new eye problems in horses in Florida, in Alachua County. 3 of them are curative, and the 4th, when I see it, I want to run away. 3 of them respond pretty easily in medicine. 1 of them is a blinding disease. And it has a real characteristic appearance, I'll show you in a second. They're treatable. This is one of them. It's one of the good ones. If you kind of look underneath, up here where the upper eyelid would cover, it's a little bit cloudy. Maybe you can see that. See, it's sharper and focused down here, a little bit cloudy. Here's some blood vessels. It's under the upper lid. The Springhill vets know this. They know to look for this stuff. Now, this horse is a little bit uncomfortable. Not too bad. Fluorescein negative. There's no ulcer here. The pupil is the same size in this eye as the other eye. We'll come back to that in a minute because the veterinarians, we always look at the pupil and compare the sizes. If there's inflammation inside the eye, the pupil's small. With this disease, it's just cloudy, and there's no ulcer. So we now, through trial and error and seeing a lot of horses, we finally figured out this is one of these immune-mediated keratitises, immune-mediated corneal diseases that's in Florida. Generally, though, this one you treat it and it doesn't come back. But what started it? We don't know that yet. Then there's this one. There aren't too many eye diseases that you just know what they are from 5 feet away. If you get a look at them, I know what this is. And this is one of them because of the color. Kind of has this greenish orange kind of color.
And it also does not stain with fluorescein. It's a little bit painful. Some of the eyelashes are drooping just a little bit painful. But it's the color. And what it is there's been a blood vessel here. I think, I don't know if you can see it. Here's a little red blood vessel here. And it has capillaries, and the capillaries leak some blood into the cornea. And horse blood, if you take the red blood cells out of it, horse blood is kind of a greenish-orange kind of color. And so this is actually blood. It's called blood staining. It goes away. But initially, there's nothing else that looks like it. And it's treatable. Okay? It can go away with some just eye drops. There's one eye drop called cyclosporin, and if the horse needs it for a long time, we can put these little silicone implants underneath the conjunctiva, and the medicine just leaks out 24 hours a day, and it can be very helpful for these horses. Some owners want to do that, some owners don't, doesn't matter. But you always try the eye drops first. If the eye drops work, and it takes some time, you can put these little implants in. They have enough cyclosporin to last an average of 14 months. And it can be done in a standing horse, and they're not too expensive for this kind of stuff. Generally, though, we found out that most horses need 2 implants, or even 3. So we just stuff up 2 or 3 of them in there, and it really seems to help a lot of these horses that have the 2 forms I mentioned. And then there's this. You see how the blue color goes up and down? Let me look in this one. There's some blue in here with the edges. But it's kind of a circle. Look at this one. Well, I got the arrows in here. This picture I think I took in 1987 or something. I didn't know what it was. I knew the blue was water. And then I knew that later that every eye I saw that had this vertical column of blue, every eye got glaucoma later. Glaucoma meaning the pressure got high. And then we got more and more data, and other people started talking about this throughout the world. And now this has a horrible name. It's called endotheliitis. I wish it had a new name. I don't like this name, but it's what it's got. So basically, immune-mediated corneal disease has superficial part. Those get better. And then it has a deep form, which doesn't. And unfortunately, it can be in both eyes. It's incredibly painful. Horribly painful. And right now, there's no cure. We can control it for a while, but it doesn't get better. Here's another one. See, up and down. I never want to see this again. I got in this business to save sight. And this one's frustrating. It tears my heart out to see these. Here's another one. Up and down. Here's the other eye of the same horse. Eventually the blue went everywhere. And he got put down. This horse was a really nice horse. He was so miserable, and we did everything we knew, and it wasn't enough. And it really hurts. If you see, you watch, your veterinarians knows when they see blue to look for patterns. And if they see this, then we got a problem. Horses are out in the field or the paddock or whatever, they get little things in their eyes or whatever, little foreign bodies. And, I saw one today, and a little piece of dirt or a little piece of a twig or something. And horses are painful. I rather like these things, in a sense, because you get rid of them and then the horses feel better. And but here's the problem. When I see something that seems this simple, how do I not know it's going all the way through? Sometimes it's a guess. you know, it's like sometimes you pray it like, okay, I'm going to flip this thing off, and I hope, well, here, if a horse eye ruptures, it makes a noise. And I've been lucky or unlucky enough, I don't know whether, to have been standing there when it made the little, it goes, you don't want to hear, I mean, you don't want to hear that, okay? Anyway, so this one was real superficial. Look, here's the first scene stain. Look, it's got a little ulcer. Got rid of this, got that off. Treatment with antibiotics, 3 days, it'll be good, no problem. You just got to make the diagnosis. Now look at this one. This is a video. Now, look, we're going to be pulling on. Look, see this stuff? This is inside the eye. Oh, we got to start this over. You got to see this again. Watch this. This is inside the eye. It's called fibrin. And I'm going to pull on this. I'm going to pull on this and watch this. It moved. That's bad. This is not a good thing. Look at this. It's like one of those horse. How the horse guy's eyelash, you know, big eyelash is called a vibrissae. How that got in there and went all the way through? Actually, I had to suture this hole. It was so thick. And it's like, how do the horse do that? Horses just find ways to hurt themselves. You know this. And anyway, so one of the things we did over the years is look for ways to help the horse heal. And various countries have used different, they're called biomaterials. So we started using part of the placenta, you know, what the foal is born in, and when it comes out with the mare, and it's got two parts to it. There's a red part and a white part. You take the white part, clean it, and put it on the horse cornea. It helps speed up healing. Who would have thought of these things? It wasn't me. I just took the information and ran with it. And I treated well over 1,000 horses with this. Now, at first, we were suturing it to the cornea. Now, we've got the amnion in a bottle. You can give it as an eye drop. It's like, who thinks of these things? Basically, you take the amnion, put it in a blender, and blend it all up, and then you can use it as an eye drop. And I'm thinking, that's better than suturing. And anyway, so here's what one of the here's the amnion suture to a cornea. I missed the beginning one. Here's what it looks like later. It's got a scar. Here's what it looks like several years later. It leaves a little bit of an opacity, but it was much better than initially, and the picture didn't drop. I'm sorry. But amnion can be very helpful, and your Springhill vets, they know about this stuff too. And now this is a horse. I want to stop this. This is an eye that ruptured. And what I learned here, what we all do, no matter what profession you're in, if you have a problem, you go to a book or the internet or whatever. You go somewhere and read about it. And guess what? Books are filled with errors. You know, I know I've written books, so it's like there are a lot of opinions there, and you may not be right. But it was right when the day you wrote it down, but maybe 2 weeks later it's wrong. Anyway, so when an eye ruptures, I was taught it was hopeless. Then I learned that this is the eye trying to save itself. I've been doing this long enough that I've seen horses that were out in pasture. Something bad really happened where their eye ruptured. They got no therapy at all. You know, like a broodmare or something way out, you know, nobody saw it only a few weeks a year. And when it was gone, and it had an injury, got no therapy at all, and it comes back in, it's got a scar and still got vision. So I learned from this, how does the horse do this? Well, if it has a hole in its cornea, the iris comes up and plugs the hole. So an iris prolapse. It's a rupture. And this is, if you read books on ophthalmology, they say, well, if the iris is sticking out, just push it back in. It doesn't want to go back in. It's happy, it's out. It's plugged. It's free. Anyway, so you'll see here in this one that this isn't me, because iris has got blood vessels. Look, they're afraid. They're going to cut it off, and then he got afraid because they know that iris has blood vessels in it. You don't like bleeding. So look, I'm cutting, or whoever, this is one of my people cutting it, and it's bleeding a little bit, but just take cautery and stop the bleeding. But there's a hole. There's a hole. There's tissue missing. So I learned how to do corneal transplants in horses, and I'm real proud that I've done more corneal transplants successfully in horses than anybody else. There's more corneal transplant. There's of horses, dogs, and cats. The most common organ transplant in veterinary medicine is corneal transplants in horses. And I remember the first time I talked a client into letting me do it. The horse was insured for $1 million. It wasn't worth $1 million, but it was insured. I had to talk to people in Montana. Say, this horse needs a, and it worked. I got a video of the horse winning a race, afterward. He hurts his knee later, but for a while he could see really well. He always could see, he just went lame. Anyway, this is a corneal transplant, okay? And sometimes it's routine now. But there was a time when we didn't know if we could do it or not. And here's a little baby, a little mini foal, and he's got an iris sticking out. So he has a corneal transplant. It's just a baby. And yeah. Okay, I'm going to get you now. Okay, now we're going for tears. I guarantee I can get most of you crying here shortly. Positive tears. Anyway, so the mini foal, the mini mare. Anyway, then this disease shows up. Here, let's look at the picture. Blue is water. We don't care. Yellow, white is cells. Red is blood vessels. And we eventually named these abscesses. And if they're really deep in the cornea, they're most likely fungus. Now, fungi, there's fungi and bacteria. There's fungi under your fingernails. There's fungi in the hay. There's fungi. 95% of horses in this county with normal eyes, 95% of these eyes have fungi just growing there. They're everywhere. And some of them somehow get deeper into the cornea, and some of these fungi get stuck or punctured into the cornea. The cells start to accumulate. They form an abscess, and they can just I would call them they're sight threatening. If you can't control this medicine, then they can lose their sight. And here's just an example. Here's an abscess. This one's yellow. The blood vessels aren't growing into it. In fact, here's during surgery. Look, look at the red blood vessels. Here's the abscess. They're missing it. So we did a whole lot of corneal transplants for this, and that was good. But listen, over west of here, I had at the same farm. I had 3 horses in adjacent stalls that in their left eye all got stromal abscesses at the same time. Boy, is that bad luck. They all got better on medicine, but it was like, what? How do horses do this? Now, if your horse lacerates his lid, to me, these are always Saturday night. Are these always Saturday night? The owners are always drunk, and I'm like kind of, and usually funny as hell, pardon me for swearing. They're drunk, happy, and I'm trying to suture this damn lid. Listen, upper lid is more important than lower as far as function. If the upper lid is injured, gotta fix it. Don't just cut this off. Or don't let somebody cut it off. Suture it up. Oh, sorry. I guess. Hey, what I got here? There we go. Here's another one. Here's suture. Okay, suture. Gotta suture these up. 75% of the eyelid movement's in the upper lid. Now, why is that important? Because it distributes the tears. If the eye's just open, the tears are going to dry out, and the horse is going to have a terrible time the rest of his life. What's it say?
Make sure if you're using these kind of buckets that the J-hooks get taped up. But sometimes you just can't figure it out. Horses just do stupid things, you know. But everybody's looking, and make sure do your best. But if it's the upper leg gets injured, and it's Saturday night, call Springhill, have some scotch, watch Erica come and fix this, it'll be hilarious. But she'll fix it. The last little thing here, almost last we get done here, is this disease, mood blindness. You don't want much worse in the Appaloosa. Maybe that's one reason that the number of Appaloosa horses in the United States and Canada is declining, partly anyway. It has to do with the pigment. In Appaloosa is not having normal pigmentation. That gene that does this, the Appaloosa, also causes immunity to be abnormal inside the eye. In Appaloosas, 80% of the time it's in both eyes. Non-Appaloosas, it's only 20%. It's not a disease that gets cured. In the old days, old-time vets, there are books that exist from the 1700s, 1800s. The cavalry horses were worth more than soldiers. So the old-time vets, they kind of kept track of eye problems. And they were making this diagnosis back then. Even the Roman cavalry, they knew that some of these eyes had some sort of blueness to them. And so, anyway, there is a new therapy for this. It involves cyclosporin as well. Here's an eye that used to be blue, now it's changed color. That goes with uveitis. Here's an eye that's got a lot of pus inside the eye. It's not a problem. It just helps me make the diagnosis. We put these little implants back underneath the white part of their eye, and I'll show you what this looks like. I won't show you the whole thing. There we go. I'm dissecting down in here. I'm making a little pocket. There's enough medicine in here to last 3 to 5 years. I was in Texas recently, and I saw 5 years in 1 week. Seriously, the owner kept track. 5 years in 1 week, it stopped working, so we had to put another one in. She was really happy. 5 years would have been perfect. And so we're making this little pocket. And got this little round implant here that has the cyclosporin in it. Little slippery little rascals. And so we put it inside the pocket, suture it up, and then it starts releasing medicine. I think there'll be more and more of these kinds of things with different kinds of drugs. Anyway, the last little bit is cataracts, and then we'll quit. I just want to talk a little bit. I hope you never run into one of your foals that's born with cataracts. They're always beautiful foals, beautiful legs, and yet they can't see. And it really tears your heart out. They want to see, but they got cataracts. Cataract means that the lens is not clear. This is me. I've got 2 little cataracts in my left eye, and these little tiny little cataracts. This cataract in this full eye's huge. It's huge. And this is, anybody know what breed this is? It's the only breed of horse that has a hereditary cataract. It's Morgan's. It's right in the middle. It never gets worse. Doesn't progress to blindness, but it's there. Morgan people aren't very happy about this because nobody knows what the future can be with these. Cataract surgery can be very successful, but it's also a lot of work. And I'll just show you what this looks like. Here's a cataract in a fold. And it's the same machine that you use in people. Made longer needles because the horse side's bigger. This thing acts like a little jackhammer. And when you live, if you live long enough and have cataract surgery, this is exactly what it's going to look like. And it's like a little jackhammer, and it puts fluid in the eye and shatters the cataract, really explodes it, and then it sucks it out. Kind of clever. The guy that thought this up was getting his teeth cleaned at the dentist. Seriously. And I'm thinking, I wonder what he told the first patient. that put a dental probe inside of his eye. See how this just sucks it right out? I did 5 of these last week. 2 babies and 1 adult. They all work. See, it just sucks. So I don't know if you've ever been around a blindfold. Young foals stick real close to the mother anyway, to the male, but if they're blind, they don't get too far away. They don't play much. And so this baby had cataract surgery. And so we took the baby away and sedated the mare. She got upset. The baby's gone. She gets upset, so we got her sedated and she's put somewhere else. Did cataract surgery. See, she's got a little mask on. Keep them rubbing. And this always gets me. Surgery's over. We're taking the baby back. Pushing her along. She's not a walk either. We're not to be glad. Anyway, so she moves. Finally, we get about 20 feet away, and she stops. And I'm like, what? The mare's there, 20 feet away, there's the baby, stops. And what's going on? And one of the students, goes, she's never seen her mother. And I'm like, she's never seen her mother. I'm crying, and everybody, doesn't work. An old man crying, never seen her mother. Then she finally figured it out, and then boom, it's like playtime. And she just had surgery. It's like she's kicking the mother. Now she can kick her because she can see. It's quite amazing. I can always tell the day after surgery if they have on the phones is because they were easy to catch and treat when they were blind. As soon as they can see, that's the last thing they want is somebody putting eye drops in their eyes. It's going to be it's really, I don't know, that's why I do this kind of stuff, because it's just almost better than drinking, but not quite. Anyway, the last little bit, horses do it, they are at risk of getting cancer around their eyes. There's some new things on that out that Springhill people will be able to help you with, or they call me about some new therapies for cancer. Squamous cells with one. They can look pink masses, pink lumps are bad, right? If you see a pink lump, get somebody to look at it. Before it gets really big, it kills the horse. Here's one. This one's bad. This horse is a white pony that never goes outside in the daytime now. And because of the chronic sunlight exposure. Here it's getting the surgery, getting it removed, and here it is. See, he never gets to go outside. He goes out at night. So, okay, one last little bit here. Sure. These, what have I done with mine? I've lost my phone. These things, they're incredible for taking pictures of horse eyes. So, I get pictures all the time from all over the world. And so Eric is going to crawl under his chair. But if you've got a horse with an eye problem, take a picture of it and send it to them or me or something. Whatever. It's like, let's take a look. If you're over 20 and you can't figure out how to do it, get a 10-year-old kid to do it for you, because they will do it. And it's amazing. These have changed everything positively, I think. In fact, one of my friends says they're indispensable for horse ophthalmology. Because if you can't get to them, if I can't see it, hey, Erica can't see it, you can get a picture and go, better come anyway, or it can wait till tomorrow, or whatever. It's very, very helpful. And so, anyway, leave me with this, safe side. Let's try not to have blind people. Here's the eye patch. Where do you get these? Where else? Amazon.com. This is actually one of my ongoing cases, and it's lost its eye, and it was removed, and they never look at people, always hated it. So they made an eye patch for this, the horse wears it, and yet now when he's got the horse, he's only got one eye, and we're struggling, and if you're a prayerful person, this horse is named Jazz, and he needs your prayer. Because he's an Appaloosa and he's got uveitis and he's got it in his open eye. And he had a flare up today. And his owners they're working hard. But it's a bad situation. Anyway, thanks for coming. And, yeah, questions or comments or did I get you though on the phone? Yeah. Okay. Yeah. If you're gonna have to yell, I don't hear very much. Yeah. Yes. Yeah. He got it bilateral, he got both of us. Yeah. 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 It triggers it when the lepto disappears, and then the immune system. I don't know why God did this, but the lepto is a bacteria, and it's made of proteins, and some of the proteins on that bacteria are always found inside the horse's eye normally. So if they get exposed to this bacteria, sometimes the eye starts thinking that they're there, and it starts destroying the eye. And so the bacteria can start it, but then the bacteria disappears, and then you're left with this autoimmune disease, and it's really terrible. We're starting to see that there's some genetic predisposition to this too. We don't know. Someday maybe we'll know. It's a terrible disease. It never goes away. Here, let me throw this other idea out to you. If you have a horse with an eye problem, and you think it's better, it's not. It is, but don't stop the therapy. I learned this the hard way. What we do now as vets is, when they get better, we wean them off the medicine. Don't just cold turkey stop it, we wean them off. Because what if we're wrong? Yes, they are better, but they're not better. They're just kind of waiting. And that's what uveitis does, is it has these cycles. Full moon, it's bad. Full moon goes away, it's better. Full moon, it's bad. And full moon goes away, it's better. Or some sort of cycle. And the cycling, even when the horse is better, it's not. So, I always like it when I'm treating a horse, and the owner comes in, I ran out of that medicine, and it's better. And the owner says, I ran out of that medicine a week ago. And I go, good, doesn't need that anymore, so they solved that issue. But, you have to be, a certain amount of paranoia has to be going, don't you think? You learn to be paranoid about this kind of stuff.
Now, the lepto is different than what the Appaloosa's got, right?
Yeah, Appaloosa's, it's genetic. They think they found the gene, the Canadians think they found the gene.
Okay.
So
if you have an Appaloosa with lepto,
actually, you can find out, no, that's actually the truth. If they're lepto-positive, the disease is harder to control than if they're negative. So even in an Appaloosa or a non-Appaloosa, it's always worse if the lepto is involved at the beginning. You have a question? Comment?
I am just totally freaked out.
Me too. Welcome to my world.
I am a Nazi when it comes to eye boogers. I am constantly thinking eye boogers, but watching this is just making my skin crawl. Is there anything you can prevent any of this?
I can reduce your paranoia, though, and that's that you need to learn how to use fluorescent light, which is, and you need, just because they got mucoid discharge, that just means the tears aren't draining properly, and so some horses just do that. You can get their tear ducts flushed, and it's fine. But you need to watch the eyelashes. If their eyelashes are drooping and they've got this discharge, it's time to get somebody to look. If the eyelashes are okay, probably just keep them clean, and that's okay. But what I'd ask you to do, since you're aware of all this, is you need to take it to the next step, and you look beyond the eye goobers. You say, okay, what do his eyelashes look like? Okay, they're okay, and then if you even get the next step is,
just kind of sneak a peek at the eyes. Are they both shiny, or is one of them kind of bluish or cloudy? And you could do this in seconds. Do you bring your horses in here, or do they come out to see you? My point is, next time the vets are there, have them just show you the 30-second eye exam, or the 15-second eye exam is even better, where you just say, okay, I got goopers, but it's like, everything looks good. And then you can not be as paranoid. I'm
Ann is also a
paranoid.
master
It's a
with
way
a
of life.
smartphone.
I'm sorry?
Ann is a master with the smartphone pictures.
There you go. Well, smart. There you go. That'll do it too. Yeah. I mean, they love those pictures. Send them every day. This is how you don't get invited back somewhere. So just send them out. Her personal phone number is 352. Yeah, go ahead.
I have 2 Rocky Mountains.
Oh boy, I left them out, didn't I? I was thought about talking about Rockies.
Yeah.
Yeah. Where'd you get them? Up north or down
From
here?
Kentucky.
You. Okay. And now your comment. Are they normal? Are they normal-eyed? Or do you know?
I've never had an ophthalmologist look at their eyes. I've had my vet look
Yeah.
at them and said that they didn't see anything.
No cysts?
But
Yeah.
do I need to keep up with that?
No.
Is it something developed?
No, not unless you think there's a change. It's usually not a progressive thing. They're born. Rocky Mountains have a hereditary eye condition what color are yours? Chocolate?
Chocolate.
Oh boy, you read the book on him. If they're chocolate in color and then they have the flaxen yellowish kind of mane, they're at highest risk. And what it is, they can have a mild eye problem, which are called cysts. If they have, genes come in pairs. If they get one bad gene, they get the cysts. If they get both bad genes in pairs, then they can be blind in the eye. But if they only have cysts and it's not progressive, it doesn't see, or maybe it doesn't have cysts at all.
I had looked at one absolutely gorgeous mare. And of course, when you have the double
Yeah. Double
gene,
genes.
and their color is just phenomenal, chocolate, pure
Oh,
white mane.
Incredible, beautiful. Yeah, incredibly
But she
beautiful.
had the bulging eyes.
Yeah, she
And
was.
they told me, oh, she can see, and I wrote her all over, but
Well, she probably could see, but she had, maybe her foals wouldn't, if you were going to breed her,
we got to breed her July.
Yes, yeah, you'd have to get the, exactly. Well, what's funny what's interesting about the Rocky, my colleagues have been threatened with death from some Rocky Mountain owners. And the Rocky Mountain people used to have an incredibly beautiful website that talked about the eye problems, and it's now doesn't exist anymore. At least last time I tried to find it. Yeah, it took it down, but it was really educational. And I had a lot of experiences. The very first, when I was at the University of Tennessee working. When the very first time I saw Rockies, I knew about them. I'd never seen one. The owners, who are very nice people, brought somebody who was a non-veterinarian who tested me. I always thought that was funny. Tested me to see if I knew what it had. Yeah, I passed the test, and I got to see a whole bunch more. They're really nice horses. I think though that they've done better. This was like 1985 when I first saw it. Yeah, go ahead.
A comment on that. A few years ago, the Rocky Mountain Association solicited donations, and they did some genetic research.
Yeah.
And for a while, they were being very proactive about encouraging knowledgeable breeding techniques to minimize the problem within the breeding. So I'm surprised that they have kind of shifted gears on that.
Yeah, my impression is they're doing better.
The price of black horses escalated dramatically after the research was done.
Interesting. The University of California at Davis has a whole, from hair samples, and it's actually pretty reasonable priced. You can find out if the horses have the leopard gene or what the other genes for these things. A lot of these people, if you're really a serious breeder and you think you were trying to not have a problem or find out if you've got a problem, there are ways now that are coming out there. It's like $45 to find out. Like, wow, okay, that's pretty reasonable. But rather not have to deal with that.
There's no treatment.
No, it's, you know, it's just, they're born that way. It's just it's a developmental abnormality, and you just hope they don't get retinal detachment and things like that, which are blinding. If they have the cysts, I mean, I didn't bring any pictures. They're really pretty, you know, I mean, but it means they have one bad gene, doesn't it? You know, and that they passed it on.
What does it take to make the cyst visible? What sort of exam do you do?
Actually, you know, dilate the pupils is the simplest thing. Sometimes you can see them. If they're really big cysts, you can just get them in the dark when the pupil will dilate on its own, and just take a quick, you can see them. The best way is get them in the dark, put a dilating drop in that lasts a few hours and dilate the pupil, then they're pretty easy to see if they're there. It's not difficult. I wish I'd brought pictures, I'm sorry. I didn't know.
And
We
that
got
was the
Rocky-
answer to how to see the
Rocky.
cysts in Rocky Mountains. Not for you guys, but for those guys.
There you go. I like,
The guys on Facebook right there.
oh, hi folks. We love Rockies. I liked them. They're really pretty, but the death threats were a little bit too much.
That's a little extreme.
The funny thing about that is my friend had his life threatened, and a few years later went back and looked, and the guy wanted him to look at his horses again. He said, "Don't you remember you expected to kill me?" It's like, I guess memory is not an important part for that person. That was up north. I got paid in moonshine to look at Rockies once. I thought that was actually a good way to. It was really good too. He even crossed state lines to bring me the moonshine, which was incredibly illegal, I would guess. So.
Well, we will be around with questions to answer any of your questions. Just a reminder, the Bloodmobile is still out there. They're asking for donations.